Okay, good afternoon, everybody, and good evening in Kashmir. Assalamu alaikum. My name is Dr. Mudasir Firdosi. I welcome you today on behalf of British Kashmiri Medical Association. This is one of our webinars from our webinar series, and hopefully we will be able to do a few more in future. Thanks very much for joining, everyone. I can see lots of people joining still, and we're also live now on our Facebook page, BKMA Facebook page, and you can share the page if you want to do so. We have got a brief program and two speakers. Without wasting much more time, I would like to invite Dr. Shaheen Shora, who will be chairing the first session of this webinar. Dr. Shaheen Shora is a consultant psychiatrist, and she is also a clinical director. She is passionate about patient care and also public health and promoting health and well-being and empowerment of patients. She's also a tutor, mentor, and a research lead in dementia in Hertfordshire. Dr. Shaheen Shora, floor is yours. Thank you.
Thank you very much, Mudasir. Assalamu alaikum, everyone, and hello and a big welcome to this second webinar that's been organized by the British Kashmiri Medical Association and obviously in collaboration with our colleagues in Kashmir. As you know, COVID-19 pandemic, which actually is now 18 months into being called a pandemic. It was called a pandemic on the 11th of March 2020, and it has just turned the world upside down. It affected healthcare systems, it tested the very well-established and the best healthcare systems in the world. It traveled across countries, it cut across all social class barriers, and basically I think there's hardly anyone in this world that hasn't been affected. And this is a mental health webinar, so we will be focusing obviously on the effects that this pandemic has had on life in general, but the focus today will be the impact on mental health, and hence our title, which is the facts around COVID, what the fears are, and what does the future hold. So the running of the program will be that we've got two distinguished speakers with us today. One is based in Kashmir in Srinagar, and one works here in Buckinghamshire in UK. And we are grateful to them both for being here, and we are absolutely delighted to have you all with us today. So I'm going to introduce our first speaker. And our first speaker is Dr. Yuman Kawoosa. He's a consultant psychiatrist and a senior lecturer at the Institute of Mental Health and Neurosciences in Govt Medical College Srinagar. She is today going to talk about COVID-19 related mental health problems and will share her experience from Kashmir. So please welcome Dr. Yuman. And Dr. Yuman, the floor is yours. Thank you. Dr. Yuman, do you need any help with sharing your slides or your presentation, or you're okay? You're on mute. You have to unmute yourself, please.
Assalamu alaikum and good evening. I am Dr. Yuman Kawoosa from Institute of Mental Health and Neurosciences. Today, I'll be talking about COVID-19 and mental health experiences from Kashmir. Are you able to view this slide share?
No, Dr. Yuman, we can't see the slides. We can hear you.
Okay, I'll try this. Is it now visible? I think now it's visible.
Yes, it is.
Now it's visible. So I'll be talking about COVID-19 and mental health, specific experiences from Kashmir. As we all know, as human civilizations rose, different pandemics came and struck the civilization. Since when man was a wanderer and hunter, and now we are living in societies and civilization, but these pandemics have been coming. Right from 165 AD when the Antonian plague came, then Justinian plague, then leprosy, then in 1350, the Black Death or the bubonic plague, which was responsible for almost death of 1/3 of the world's population. Then the Great Plague of London, which was again a reappearance of the bubonic plague, which led to deaths of almost 20% of London's population. Then in 20th century came the Spanish flu, which was an avian-borne flu, which resulted in 50 million deaths worldwide. And the current pandemic, the coronavirus pandemic, quite resembles the pandemic caused by the Spanish flu. This is a picture from the Spanish flu pandemic, where the healthcare workers were wearing masks, were wearing gowns. In the same manner, the precautions are being taken in the current pandemic. Continuing with the timeline of pandemics throughout human history, in 1981, we witnessed an epidemic of HIV or AIDS. Then in 2003 came the first outbreak of coronavirus, which was named as COV1, which was severe acute respiratory syndrome. Then in 2012 came Middle East respiratory syndrome, which was again caused by same coronavirus. And the present outbreak caused by coronavirus COV2, which we call as SARS-CoV-2, came in 2019. It came in December 2019, but it was declared as a pandemic on March 11, 2020, when the WHO announced that it has officially spread through 114 countries, affecting almost 1 million people. Now, why this pandemic caused so much of distress, so much of psychological outcomes, anxiety, depression, and other problems because of the pandemic? It was first because of the isolation, the social isolation or the physical isolation, which was needed to cater to this pandemic, which resulted in a large amount of anxiety, depression, and other problems. Then the social distancing, which we were not accustomed to. We had to remain socially distant from our own nears and dears, from our own friends and relatives. Then again, the deaths caused by the coronavirus, which contributed to a large amount of post-traumatic stress disorder and other disorders. Then the economic losses because of the frequent lockdowns implemented to counter this pandemic. Then again, the uncertainty of the pandemic, because now it has been almost 1.5 years. We're still waiting for this pandemic to end, and we don't know exact timing when this pandemic will end. That is why these mental health outcomes came because of the distress associated with the pandemic, uncertainty of the pandemic, unpredictability, economic losses, deaths, no definite treatment. We currently have a vaccine available to tackle with the pandemic, but we don't have a definite treatment so that this disease could be cured. And this is unending. Still, we are waiting to and get this pandemic end. Coming to the world scenario, regarding the prevalence of mental health problems during COVID-19 pandemic, there was a systemic review and meta-analysis which showed that the prevalence of depression, anxiety, distress, and insomnia was about 31.4%, 31.9%, 40%, and 37.9% respectively, which is quite high to the pre-pandemic levels of depression, anxiety, or distress seen in various studies. Again, a study done in US, which was done on a household-based survey, what they saw that in January 2021, because of the pandemic, the percentage of adults reporting symptoms of anxiety and depression rose to about 41% as compared to 11%, which they saw previously in the year 2019. During the pandemic, they saw that a larger than average share of young adults aged 18 to 24 reported symptoms of anxiety, depression, And compared to other adults, they also reported to increase the substance abuse, which increased to almost twice to 25% as compared to earlier prevalence of 13%. Even suicidal thoughts, suicidal ideation increased to 26% as compared to a previous of 11%. Throughout the pandemic, what they noted that women have been known to report poor mental health as compared to males. All other studies support this phenomena. For example, what they saw that 40% of women reported symptoms of anxiety and depression as compared to 38% of men. They again compared the outcome of this pandemic on essential and non-essential workers. And they saw that the symptoms of anxiety, depression, substance abuse, and suicidal thoughts were more in essential workers who were working even during the pandemic, who had to go to their places of work even during the pandemic, and who could not work from home, like people involved in medical profession, people involved in banking, or people involved in providing essential services. So they saw that they had increased prevalence of anxiety, depression, and other problems as compared to those who were working in non-essential fields. Another study recently published in Lancet Psychiatry in Feb 2021 assessed the mental health impact of COVID-19 pandemic on people with and without depressive, anxiety, or obsessive compulsive disorders. What they did in this study was that between April 1 and May 13, online questionnaires were distributed among 3 cohorts. They took 3 cohorts from 3 different studies which were already enrolled with them. One was the Netherlands study of depression and anxiety, other was the Netherlands study of depression, and third was the study done on obsessive compulsive disorders. So they compared the patients who were already enrolled with them in 3 different cohorts, and they saw their depression, anxiety levels pre-pandemic and post-pandemic. What they observed, they saw that individuals who had more severe or chronic mental disorders reported a greater impact on their mental health, more fear of COVID-19, and less positive coping with the pandemic. And compared with the pre-COVID levels, symptoms of depression, worry, and loneliness increased during the pandemic. Now coming to a few neuropsychiatric manifestations of COVID-19 pandemic. There are different studies published which show that after COVID-19, a large majority of patients present with post-COVID delirium or post-COVID agitation. And what they saw that these patients who present to in ICU settings with post-COVID delirium or post-COVID agitation, they have a high likelihood of developing post-traumatic stress disorder when they are followed up in due course of time. Also, they saw that few patients presented with confusion, agitation, few patients had ischemic strokes after having COVID-19, and few patients had abnormal EEG findings. And most specific EEG findings seen in those patients were diffuse bifrontal slowing, which was consistent with the encephalopathy described in these patients. Now coming to the Kashmir scenario. Here, first coronavirus case was confirmed on March 18, almost a week after declaring it to be a pandemic, and the patient had a history of travel from abroad. To study the effect of this pandemic on Kashmiri population, a study was done by Dr. Bilal, Dr. Roof, and Dr. Arshid, and they studied depression and anxiety symptoms, quality of sleep, and coping during the 2019 coronavirus pandemic in general population in Kashmir. It was an online survey which was done through various online apps like Facebook, WhatsApp, and other channels, and online questionnaire was presented to decrease the contact with the patients. And what they saw that in their respondents, 55% had anxiety symptoms, 55% had depressive symptoms, 53% had poor quality of sleep, and around 30% used maladaptive coping skills. They also saw that significant depressive symptoms and anxiety were present in females as compared to males in their population. They also find that urban population had more anxiety symptoms, and mean global Pittsburgh Sleep Quality Index score was positively correlated with depression as well as anxiety. That is, patients who had more of depression and more of anxiety had also poor sleep quality index. They saw that females had a significant high mean for anxiety and depression, as well as females had more sleep disturbances as assessed by the Pittsburgh Sleep Quality Index. Also, significant high mean ranks for anxiety and depression were seen in those who were using maladaptive coping skills. Another study done on the healthcare providers which were working during the pandemic in delivering healthcare services in Kashmir was done by Dr. Alia, Dr. Zaid, Dr. Shabir and colleagues. What they did that they also surveyed this as an online questionnaire from April 8 to April 15, and 133 responses were recorded. They observed that a total of 61% respondents were single, 74% were male, 83% were doctors, and 28 were nurses. Feeling sad and pessimistic, feeling of being avoided by others, burden of change in the quality of work, worrying whether the family will be cared for in their absence, and distress due to colleagues being tested positive were significantly more in nurses as compared to doctors. They also saw that severe psychological impact was present in 60% of the respondents, and this psychological impact was more in males and in those who were married. Psychological impact was also related to the place of posting or the designation. Like severe psychological impact was reported by those working in COVID clinics or the swab collection center. Regarding the substance abuse pattern during this pandemic, a study was done by Dr. Yasir, Dr. Fazl and colleagues from the year March 2020 till current year, March 2021. What they saw that 56% of patients were very young in the age group of 21 to 30 years. 40% of them, which is an alarming high rate, were students. Predominant substance for which admission was sought in the hospital was opioids, which amounted to almost 94%. The most common type of opioid used was heroin. The most common method of using was IV, which changed from earlier, the most common method they would describe as chasing, but now during the pandemic, it changed to IV use. And 36% of patients relapsed during lockdown, or they had started abusing substances during the lockdown. Coming to the opioid substitution treatment or opioid agonist therapy, which is being given in Kashmir, buprenorphine and sublingual preparations in 0.4 milligram and 2 milligram is being dispensed to patients who are heavily dependent on opioids or who are using it in IV form. What we saw in the year 2012 to 2015, only 139 new patients were registered for OST services. Again, in a span of 3 years from 2016 till 2019, 309 patients, which was higher than the earlier number, were registered. But in the year 2020 alone, almost 495 patients, which was more than the number which was seen earlier during 3 years span, was registered with OST services in Kashmir. This amounts to the epidemic of substance abuse, which is nowadays present due to the impact of the pandemic. To study the maternal mental health during COVID-19 in Kashmir, I myself, along with gynecologist Dr. Zeenat, Dr. Zaid, and under the able guidance of Professor Mushtaq Margoob, we did a study. We collected data through online questionnaires, but we had to do telephonic interviews, and I had to go myself to conduct face-to-face interviews because we received very less responses in the online interview because majority of our patients were female. They had studied only up to 10th standard or up to 12th standard. They were not using online groups, or they were not using internet that much. So what we saw in our study that a total of 95 female, which was a little bit lesser number, were included. Our questionnaire was a semi-structured one with questions regarding socio-demographic variables, questions specific to COVID-19, copings used during the pandemic, and we had pre-validated questionnaires which are already being used, like we used Edinburgh's postnatal depression scale to assess depression in females who were pregnant or lactating, Hamilton anxiety rating scale to assess their anxiety, Yale-Brown obsessive compulsive scale to see their obsessive compulsive features. Mean age of our study population was 30.8 years. Majority of our patients were married. They were homemakers and they studied up to 12. Major depression was seen in 43% of females, which is quite a high number as compared to the earlier studies done in the same region in pregnant and lactating females, which show the prevalence of depression to be around 23%. Mild anxiety symptoms were seen in 69%. Severe anxiety was present in 8% of patients. Mild obsessive compulsive disorder was seen in 16% and moderate in 10% of cases. What we saw regarding the coping mechanisms in our study population, 88% used involvement in family activities, involving with children, involving with other family members as they're coping during the pandemic, especially during the lockdown period, followed by religious coping used in 37% of patients. Only about 10% of our patients used reading, writing, or art as a coping during the pandemic. We also observed that being hospitalized for COVID infection increased the risk of depression by almost 2.5 times, and belonging to high-risk group or visiting the place of work during pandemic increased anxiety scores by 2 times. There were a few limitations of the current study. First being the cross-sectional nature of the study. We did not see the outcome regarding the behavioral manifestations in babies or newborns during the pandemic, because it could have an impact on their behavior and other manifestations. Also, we had a smaller sample size. A larger sample size could give us better idea regarding the outcome of pandemic on maternal mental health. Coming to the mental health services and COVID-19, a survey done by WHO in 130 countries showed that all the services, including the mental health services, were disrupted because of the COVID-19 pandemic. Even the OST services were hampered at many of the centers because most of the centers were being converted to COVID care centers or COVID hospitals. Coming to the Kashmir scenario with respect to the services provided, Institute of Mental Health and Neurosciences is the only mental health care facility which is being provided to the whole population of Jammu, Kashmir and Ladakh, which provides a long-term residential facility for psychiatric inpatients. These facilities are not being provided at other hospitals present in the region. This hospital was functional during the whole duration of the pandemic, even during the start of the lockdown. In the outpatient department, we tried to use the PPEs, face shields, and we tried to maintain a 2 feet distance with the patients, but the services were continued even during the pandemic. Regarding the inpatient, new admissions were discouraged in residential inpatient wards, but where necessary, we used to admit patients after doing their rapid antigen test, which when came negative, we used to do RT-PCR for a confirmation. And when RT-PCR came negative after 2 or 3 days, we used to admit the patients. Till then, we used to keep the patient in isolation. After that, we used to shift the patient to the residential inpatient wards. And families were discouraged to meet residential patients in the in-care facilities. Coming to the ECT services being provided at Institute of Mental Health, they were provided as norm twice a week. Theater staff included 4 members who used to wear proper PPE, proper masks, N95 masks, face shields, gloves. Adequate ventilation was ensured. RT-PCR was performed 2 days before doing the first session of ECT. But for the repeated sessions, we used to do rapid antigen test because it was not possible to do RT-PCR every time the patient came for the repeated session of ECT. A total of 312 sessions were administered to 45 patients till July 2021. Telepsychiatric services being provided to patients during this pandemic. To minimize the patient influx to hospital, various platforms were established. Helplines, phone numbers, WhatsApp groups were provided. Guidelines specific to mental health were uploaded on the official Facebook of Institute, and telephonic consultations and video consults were also available to patients. Till December 2020, almost 14,987 telephonic consultations have been done and 5,000 video consultations have been done. Summarizing the services provided by Institute of Mental Health and Neurosciences during the year of pandemic starting from March 2020 till May 2021. Total number of outpatients seen in the department were almost 83,752. IPT patients admitted during this year of pandemic were 1,234. We have a separate de-addiction ward running in the hospital, and the admissions were almost 385. The de-addiction OPT catered to almost 8,900 patients. And coming to consultation liaison consults, in the initial period when there was a peak of the pandemic and when there was a lot of fear and stigma associated with it. So at that time, to avoid contact, we used to have telephonic conversations with doctors in other specialties for consultation liaison. But whenever needed, we used to go there and see patients wearing proper PPE and masks and other precautions, taking other precautions. So summarizing the impact of this COVID-19 pandemic, it impacted the whole of the population, but it had a spatial impact on spatial populations like children, adolescents, and young people. It had a spatial impact on healthcare professionals who were always on the front line, working even during the pandemic, who could not work from home even during the pandemic. So we had people who had pre-existing mental health conditions. In them, we saw an increase in the prevalence of already suffering psychiatric disorders. Then we had patients who tested positive for coronavirus, and some of these patients later on developed depression, anxiety, and other psychiatric disorders. So we tried telemedicine, we tried teletherapy, we established helpline to cater to this pandemic. We provided training to healthcare providers, counselors were recruited, and our goals were protection and enhancement of public mental condition to adapt to COVID-19 pandemic. And we tried to address the socially disruptive consequences in regional and global scale. But in future, we need to understand that high quality mental health services need to be provided to the people, which should be easily accessible and which should be equitable for all citizens and even for the healthcare providers themselves. As we all know that sometimes we are tested not to show our weakness, but to discover our strengths. So maybe this pandemic helped some of us or most of us to discover our inner strength, to cope even during these tough times. And we all know that our greatest glory is not in never falling, but in getting up every time we fall. Thank you.
Thank you very much, Dr. Yuman. That was a very detailed, very impressive presentation. I was particularly impressed with the amount of work you people have carried on delivering and the services you've kept running during the whole year of COVID-19 pandemic. I think in comparison, I would say compared to what all you have been doing and delivering, including ECT services, running de-addiction clinics, running addiction inpatient services is very impressive, because if I compare it to where I am working and generally speaking about the National Health Service in UK, we almost came to a standstill and were delivering just emergency services and focusing only on emergency services, especially during the first peak. April, May, March, April, May last year. And we slowly started opening some services in June, but there were no regular outpatients. We didn't have a concept of telemedicine around that time. So really commendable what you and all your colleagues at the National Institute of Mental Health Sciences and everyone else working there in mental health has delivered. You did obviously touch upon a lot of other relevant things as to how COVID-19 impacted certain classes or groups of people, particularly children, youngsters. Then you gave us the prevalence of depression, anxiety, how it affected women a lot more. Again, something interesting in your presentation was how the working class, be it healthcare workers or those men that were in work, seem to have had a greater impact on their mental well-being and on their health. I think in terms of also how many surveys you've conducted and some of the studies you've done within very challenging times of dealing with the pandemic, a very new, novel experience is very impressive as well. So amazing, amazing stuff. I think to conclude, I would say we'll leave the discussion and any questions in the question and answer session.
Okay.
And I think we will move on if you are happy with that, and obviously you'll stay with us till the question and answer session, and we'll come back to the. Now, just one thing to say, I did get a message in the chat box to say that some people didn't quite sort of get a larger picture of the slides. So it may be we might have to amend the slideshow slightly and make it, a more bigger image. So we'll do that. So thank you very much.
Thank you.
Dr. Yuman, we will now move on, and we are well on track with time, which is always great when we have these webinars. And I see a few more people have joined us, so we are well into 30s, which is good. So it's my pleasure to introduce our next speaker, who is Tasneem Shikoh. She is a Kashmiri based in the United Kingdom. She works as a psychotherapist. She is BACP accredited. And at present, she's working with Mind. Mind is the third biggest mental health charity in the UK, and she's based in Buckinghamshire, and she's currently working as the Counselling Operations Manager. Tasneem has a lot of experience working with depression, anxiety, trauma, loss, abuse, and other mental health issues. She's also worked with projects involved in mental health support for victims of major disasters, and one of her piece of work was with the Grenfell Tower fire, which happened in London a couple of years ago, before COVID. She's also a member of a charity called Listening Hearts in India. And during COVID, she has been providing remote mental health support to people affected. So a lot of experience, a very impressive bio. And today, Tasneem is going to talk to us about how to help yourself and others to cope. So basically, what can we do? Over to you then, Tasneem. Thank you.
Hi, can you hear me?
Yes, we can.
Hi, can you hear me?
Yes, we can.
Hi, Assalamu alaikum to everybody. Thank you for the opportunity to invite me to this a very important topic, which is very close to my heart and I'm quite passionate about. As Dr. Shaheen has given the introduction, I'm Tasneem. I work in Buckinghamshire. I live in London, and I'm quite passionate about mental health. Our colleague Yuman has really clearly given a lot of information about stats and figures and what medical professions have done. And I would be mainly talking about mental health. What does it mean? How does it impact us? And what can we do to help ourselves and others near us, around us, to overcome and have some of the coping skills. So I'm going to be trying to share the screen. So just bear with me for a second. Let me share the screen. Can you see the screen? No.
We can't see it as yet, Tasneem.
All right. Give me 1 second.
Yeah, that's fine. Please take your time. As I said, we are well on time, so no rush.
Okay. Can you see the screen?
Yeah, we can.
Okay. No, hold on. I did a wrong screen, actually. Share. Give me 1 second.
Absolutely. No worries. Take your time.
Okay. Okay. Can you see me now?
Yes, we can. It says 19th of June, which is today. So I think it's probably the right one.
Right. And can you see the full screen?
We can. Yes. Thank you.
Wonderful. Wonderful. So I'm going to talk about the impact of COVID-19 on mental health, how we can help ourselves and others to deal with mental health issues. what is mental health? What we all say and talk about mental health. What does, can you hear me? Can you guys hear me?
Yeah, we can. I think.
Okay. So what does mental health mean? Mental health is any kind of mental health condition, issues, disorders, which can affect your mood, your thinking, your behavior. It causes stress, anxiety, phobia, eating disorders, addictions. So there are lots of things. When people say mental health, there's a wider scope and wider things which mental health actually covers. So global impact of mental health, global impact of COVID-19 on mental health. Impact of COVID has resulted in many mental health issues, which has negatively affected many people. So many people are reporting some of the following symptoms, and there are really very few, and there are more. Anxiety, depressive or disorder, stress, difficulty in sleeping, eating disorder, increased in alcohol consumption and substance misuse. These are some of the mental health issues, and there are many more. Clearly, it's not easy for me to capture all of them in this presentation, but I'm just going to give an overview. Now, we do not fear the unknown. We fear what we think we know about the unknown. It was a saying by Teal Swan, a spiritual leader, and it kind of stuck with me. We all talk about unknown, and it's about, we're not actually worried about what unknown is, but it's the fear what we think we might know about unknown. So we go through stressful situations and times in our life, and all of us do. However, fortunately, we have, not most of us have been through any pandemic. However, this unknown has caused a lot of stress, worries, which can take over our minds. We feel overwhelmed with failure, unable to help others, the fears, the dangers, the worries, and some of them might be real, and some of them might be far from reality. Fear, worry, stress, and normal responses to perceived or even real threats, and more so at times when we are faced with uncertainty or unknown. So it's normal and understandable that people are experiencing all these emotions and these sense of helplessness during COVID. Added to the fear of contracting the virus, which we're all worried about, whether we have the vaccine or we don't have the vaccine, we do the social distances, we don't. There are significant changes to our daily lives as our movements are restricted in support to effort to contain and slow down the spread of virus. And that has also affected on our mental health. Mental health in Kashmir. As you can see, the 41% mental health has increased. There is stats there. I'm not really going to talk about the percentages and the numbers because they're there. What I'm going to talk about more is what happens in Kashmir. What affects mental health? Lockdown has had a big effect. Isolation has had a big effect. Unemployment has a bad effect. Bad news. Every day we are hearing our loved ones are in the hospital, so and so has died. That has affected mental health. Our fears of unknown, what's going to happen or what we think might happen. Disruptions and changes. These are all have had issues on our mental health, has an impact on the mental health issues. Problems in paradise. Now, mental health workers say Kashmir is witnessing alarming increase in the instances of depression, anxiety, psychotic events. Suicides have increased. Preventive measures like social distances have led to increase in loneliness. As much as we think social distances is good, we all like to give a hug to our loved ones, go and give a pat on the shoulder of somebody who's achieved something, but we're not able to do that. And the feeling and being neglected, particularly for elderly population, which has actually resulted in mental health issues as well. Impact of COVID has created a generation of population who feel traumatized, isolated, and scared with little access to help, and especially in Kashmir Valley. So let's understand what are the triggers. When we talk about all these, what is actually trigger? What's going on for us? So it could be watching on the news. It could be hearing about others catching the virus. That could be a trigger for us. It could be watching people struggle in many ways and not being able to help in the way we want to help. It could be developing some basic illnesses like normal headache and thinking actually I'm getting COVID, that could be a trigger. And recognizing your emotions when you actually get the trigger, what happens, becoming aware and acknowledging the changes in thinking. So what we're going to think and how we're going to behave, which is then manifesting in stress and panic. Know about yourself and identify if there's anything underlying factors or anything else which can be actually increasing the stress. Your personal values, perceptions, and attitudes that make up your belief system, and aware of your own self-defeating thoughts, that I'm not helping anybody, I'm going to catch COVID, those negative thoughts. But it's recognizing your barriers and change your approach, and that's quite important. So researchers have shown that most of the people who feel extremely stressed feel dread, overwhelmed, and helplessness. They have this all and nothing approach. There is no gray areas. It's a black and a white, and they can't see in between. So they will use the absolute terms and explain that never, ever. Those are the terms which people start using. And then that's a sign of triggers. Hence, they're able to see the solutions out of the problem. They're unable to see how much and what they have actually helped. Actually just helping, putting the mask on, washing my hands regularly, social isolation, but I'm not able to actually acknowledge that. And that's never, I will say, well, I'm never able to help. Well, actually, I'm failing to understand that I am helping in the best way I can, even if it is little things. The idea behind this session today is to identify negative automated thoughts, which are in us, and unhelpful behaviors. These are the learned behaviors, which are negative thoughts, and eventually we will learn to modify them. We need empowering skills to develop coping skills and deal with their concerns. So let's accept, yes, it is uncertain situation, but at the same time, let's identify and focus on the positives. We have the vaccines, the pandemic is getting somehow controlled. A lot of people have come out of it. So let's have that positives as well as keep that in mind that, okay, it is a situation which is uncertain at this time. How can you change the thinking pattern? And that's quite important. Thinking through the situation. So what am I going to do if I'm in one of these situations? How am I going to react? So be mindful that thinking too much about the worst case scenario is a double-edged sword, and it can cause fears and stress. That becomes the point, and there becomes a point where constant thinking and planning the worst case scenario actually impairs your quality of life, helping ourselves and others. The idea is to build the resilience, which is ability to recover readily from the adversity. Highly resilient individuals nurture positive emotions proactively. So researchers have suggested while we might all get ramped up and experience the symptoms of fear and stress, well, our brain is still working, we're still coping, we're still here, we're still living, we're still eating. So a flight and a fight reaction causes stress, and some of the level of stress can actually be good in certain situations. But there is a point when stress and fear becomes counterproductive. So we've got to be mindful how far and how less we are thinking. So there are three different thinking patterns. One is a cognitive triad, dysfunctional belief, and cognitive error. So cognitive triad is a person thinks about self, others, and future. Dysfunctional belief. Now these are the beliefs that was formed during the early development and can trigger when a person faces challenges, in this case, COVID. It can be that people have this belief that vulnerability is weakness. If I'm thin, then I will only be loud if I'm thin. Henceforth, the person will go on dieting and excessive exercise, or I have to find one right idea. Those are dysfunctional beliefs. And cognitive errors. These are the common cognitive errors include black and white thinking, like we talked about before, jumping to conclusions, overgeneralization, minimization, or magnification. So minimization could be, I'm not doing anything. Well, actually we are, because you're using the mask, you're washing the hands, you're social isolation, or magnification. The whole world is going to die, we're never going to come out of it, those kind of things. And catastrophizing, which is what I said. So for example, as I said, I'm not going to survive the coronavirus. What's the point? What's the point of all this? We're all going to die in the end. Or I can never ever do anything. I'm never able to help anybody. Those are the thinkings which are cognitive errors. So we have to develop a new way of thinking and way forward. So we have to learn and discover the new ways of thinking and behaving to overcome the stress and learn coping mechanisms for self-help and helping others. Let's acknowledge that we all have different levels of resilience and cope differently in situations when we are faced with challenges and unexpected situations. So research has shown us that when we need to use healthy coping skills we have developed over the years, we tend to stop using those skills. The reason for this is that we either are not able to reach to that information in our brain or we completely freeze. So we all know what to do in certain situations. Somebody's finger gets cut and we know what to do, but some of us will freeze and don't know. That means we're not able to access that information in our brain and we are not able to do anything. The other reason for using the learned skills and mechanisms could be feeling so overwhelmed that we don't know where to start. So going back to the issue where somebody's finger is cut and we know we need to put a Band-Aid, but we don't know where to start, where to look for it, and our brain just completely freezes and we run out of options. Help yourself. I think all of you must have heard about 5-4-3-2-1 coping techniques, and they're quite easy to do, they're quite easy to implement, and there are also some of the grounding rules, which I would really invite all of you to try once at the end of the session. So acknowledge when you're standing, when you're in that stress, acknowledge 5 things that you can see around you. So it could be when you're standing, you could be seeing the trees, you could be seeing the cars, you could be seeing the birds, you could be seeing people walking, you could be seeing an animal. Acknowledge. So it's grounding yourself and being aware of yourself, and let's acknowledge 5 things which you can actually see. Let's acknowledge 4 things that you can actually touch around you. So it could be if you're standing in a room, you can touch the wall, you can touch yourself, you can touch your clothes. So it's about, again, grounding yourself, making yourself aware where you are, what you are, taking your thought process away from those distressive thoughts. Acknowledging 3 things that you can hear. So you could hear birds chirping, water flowing, or even the breeze around you. The other things could be acknowledged 2 things that you can smell around you. It could be the food, it could be your perfume, it could be deodorant, it could be simply the air, the freshness, the flowers, any 2 things. Acknowledge 1 thing you can taste around you, and it could be even a sip of water. So these are the things which you can use. It's called 5-4-3-2-1 coping techniques. And it's very, very useful to kind of print them, put them on the fridge. And if you go through the stress, you are going through one of those phases, and even one of them would help immensely. I would also invite you to use 12 ways to practice grounding. They are physical, mental, and soothing. The physical is, again, count. You could start counting your heartbeat. And these are very simple things which all of us know, all of us can do very easily, but it's just about reminding ourselves what techniques, what skills we all have. Breathing techniques, a small short walk and move in rhythm. Mental techniques could be have an internal dialogue with your own self, count in random numbers, label the things around you, anchor yourself with a phrase, I am the best, I can do, I'm able to, I will get better, I'm helpful, I'm kind, those kind of things. And soothing techniques could be listening to some music, listening to a story, making a gratitude list that it's not all that bad. We still have each other, we still have family, we still have roof over our heads, we're able to breathe, I'm able to get up in the morning. Just making those little gratitude lists will help us a lot. Now I'm going to come to the big part of the presentation, which is helping yourself. And the presentation will be in 2 parts, which is help yourself and then how will you cope, how will you help others. And there's a long list of things how we could help ourselves. But I'm not going to go into very long list. And I've just kind of made a couple of points, which is about 20-25 points. I'm not expecting all of you and everybody to remember all those 25 points. And even if some 1, 2, 3 would be good enough. So one of them could be hold on to the hope in the face of COVID and acknowledge you're doing your best. Focus on one hurt at a time. Try doing something that brought enjoyment and fulfilled before COVID got in the way, and picture yourself being somewhere meaningful and focus something entertaining. Interrupt anxious thoughts by picturing a stop sign in front of you, and that's quite powerful. So if you're going through this stress, if you're going through, a complete hopelessness, Just imagine you have a stop sign and stop yourself going in that black cloud. And imagine that stop sign, and that hopefully should help you to interrupt in your thought process and bring you back to the ground. Ask yourself, ask others you trust how they coped, and maybe learn some of their behaviors. Be aware of breathing. Try to stick with regular routine. Practice self-compassion, identify, advocate, and attend to your physical and emotional needs, social and spiritual needs. Keep time to relax for your own self. Do something fun that you haven't done for a long time. Don't compare yourself to others based on their experiences. As best as you can, maintain healthy sleep, eat, exercise habits, and to deal with COVID stress. Try to watch something funny that makes you laugh and smile. Listen to music that helps you soothe and lift your mood. You know, a lot of people will put on the music, and that music could be bringing a lot of pain, reminding a lot of, distress. But I would say stay away from that music. Listen to the music which uplifts your mood. Limit the social media exposure that might be intensifying what's going on, how many people had died, the percentages, the numbers. Stay away from that. Remember, you aren't alone, and it's okay if you deal with stress differently than anybody else. Try to learn to be aware of triggers, which we talked about before, and reduce the exposure of triggers or situations that make you feel worse. Be optimistic. Remember, your body needs the rest, and don't feel guilty about it. If you want to go and lie down, then go and lie down. If you want to take a day off, then take a day off, and don't feel guilty about it. Remember and learn to say no. So just, you can do only your best. And if somebody asks for help, somebody asks which you can't do, it's okay. Give that permission to yourself, and it's fine. Allow yourself to feel angry, disappointed, cry, and all these difficult emotions, because those are the emotions we all have, and give yourself the permission to feel them. Yes, have a cry. Yes, get angry. Yes, get frustrated. Yes, get disappointed, but don't get stuck in there. You will feel everything is getting, when you feel everything is getting impossible, set one small attainable goal which you can achieve, whether it's professional or personal. Talk to others, your friends, your colleagues, your family, who you might know what is it like to feel in the similar situation. It could be somebody who's got the same job. It could be somebody who's got the same kind of family pattern. And in doing so, don't feel forced that you have to go. You only can do if you feel comfortable. Try to invest in meaningful relationships. When you can, make a gratitude list and keep yourself reminding of the blessings we have: the family, the job, the health, the house, the money, the neighbors, the air, everything else. Give yourself permission to seek help from a health worker, from a care worker, and from a mental health provider. It's okay to accept help, because we can't do it all by ourselves. You don't need to prove to anybody. Let go of the survivor's guilt. We all feel guilty. Oh, I should have been in the hospital. Why am I alive? Why am I not getting COVID? Let go of it. Forgive yourself for anything you feel you could have done differently. Remember, you can only do your best under the circumstances and knowledge available. Reflect on times when you have struggled with pain, but emerged as a stronger person. Be honest with yourself and acknowledge your struggles and difficulties, and keep reminding yourself of struggles. Identify resources that give you hope and tap into beliefs that you find comfort in. Those are the things you can help yourself. Helping others to cope by encouraging them to engage. And it's equally important. So encourage them, encourage your family and friends to unwind through yoga, music, attend new hobbies. Remind and share the ideas we just talked about with your family and friends. Talk to them and explore new ways of safely connecting with family. Even though we are social distancing, we can still connect with the family. We can still remotely make a phone call, do a Zoom call, and share and support each other. Encourage them to take care of their body. Taking care of your physical needs is equally important as your mental needs, mental health needs. So if you are suffering, you have an issue about your physical needs, remind them to take care of that. Share the ideas about healthy food and get enough sleep. Remind them during the times of increased social distances, people can still maintain social connections and care for the mental health. I made a list of do's and don'ts. And it's again very easy. You can literally print it on your phone, put it on your fridge, and remind yourself what I can and what I should or I shouldn't do, which will actually lead to a healthy mental health. So do's is avoid thinking in negative and absolute terms, in terms of it will never happen, I can never do anything good. Avoid those things. Consider limiting news to just a couple of times a day and disconnecting from TV, phone, computer, and screens. Take breaks from social media. It's good to be informed, but hearing about the pandemic continuously can be upsetting. Find positives in situations, and I can just share an example with you. It's quite, I'm sure all of us are in that situation at some times when we are stuck in traffic, whether we're in our own car or in a public transport. We're stuck, we're in traffic, we can't move, and now the negative way of thinking would be, I'll get frustrated, I'll get angry, I'll think, oh my God, it's a waste of my time, I need to go there, therefore it will then increase my stress level. The positive way of thinking could be, well, there's nothing you can do, you are stuck in traffic, let me listen to the music, let me think about a good experience, let me enjoy the comfort of the vehicle, let me think and plan of something good I can do once I come out of the traffic. So these are different things we can do, and we all can do that. It's not something big we can't do, all of us able to do these things. Understand that setbacks do happen and accept them, and nobody's perfect. Nobody can do everything rightly. We all do things differently and rightly and wrongly at times. Recognize your strengths. Now there is a don'ts list. Don't feel guilty to take a break or a rest. If you need a day off, then take a day off. Don't feel shy to reach out and asking for help. Don't catastrophize everything. Don't be hard on yourself for doing or not doing something. Don't dwell on self-defeating thoughts. Don't use unconditional terms such as never and nothing. Don't feel guilty in attending to your physical and emotional needs. Don't avoid seeking medical help. Don't compare yourself with others. Don't ignore your physical needs. Don't focus on negative stuck examples, like we talked about the traffic. In negatives, think about positives. Thank you very much for listening to me. And now I'm happy to take any questions.
Thank you very much, Tasneem. That was a very detailed presentation, a lot of food for thought. Very rich in content, and I think many of us here may take your advice and put the do's and don'ts list at least on the fridge, if not anything else. Just to summarize, I think you started with the fear of unknown and the reality of a place, which is ridden with conflict, with problems, plus the COVID-19 pandemic and the uncertainties. I think that fear of unknown is the biggest reality now of lives, in terms of not knowing what's happening tomorrow, the uncertainty, the sense of feeling helpless, not being able to visit family, see parents, certainly for, professionals on this call living overseas. It's actually quite an unpleasant place to be, that there's nothing you can do, you don't feel you're in control, or you can plan things. And especially in the West, as you know, everything is so structured, sometimes so rigid that it has to be done by the book, by the clock. And unfortunately, that's not the case now. You also touched upon quite useful things in terms of, the coping techniques, but more importantly, how to change your psyche, your outlook, your thinking in terms of thinking about the positives, but also when things are not going well, to accept it, not to beat yourself for feeling low or, not having a good day, and seeking help. I think that's one of the things that did stand out from your presentation. I think we'll open the floor for questions and answers for both yourself, Tasneem, and for Dr. Yuman, who has patiently stayed with us. And we've already got positive feedback for questions from Dr. Yuman, but also for yourself. I haven't seen a lot of questions as yet in the chat, but I'm sure as we start and the discussion starts, we will have questions and answers. And We are well into time in terms of keeping on track. We haven't overrun. So we've got about half an hour, which is our session 2, which is the question and answer session. And it's my pleasure to invite Dr. Zulkarnain Ahmed. I know Zulkarnain for nearly 2 decades now, I think. He was my junior in college when we were doing medicine, and he is now a consultant psychiatrist and has been for a number of years, and he's an honorary lecturer at the St. George's University of London. He also is quite passionate about education, and he's the college tutor for postgraduate psychiatry training here in UK. So I will hand you over to Dr. Zulkarnain for the next session, but I will also be around to support, because we have to keep obviously track of questions that come through. And the participants here can write the questions in the chat function of the Zoom. So there's a little icon at the bottom of your screens, right in the middle, which says chat. So you can put a question or anything that you want to ask, either from the content of the presentation today, but obviously the topic is impact of COVID-19 on mental health. And I'm sure, we'll be happy to take questions which may be a little bit wider. But if we direct the questions to the speakers specifically, then it will help us obviously direct the questions to them. So over to you, Zulkarnain, and thank you.
Well, thank you, Shaheen, for your kind introduction, and Assalamu alaikum, everyone. And so we'll start with this Q&A sessions. I would also like to thank BKMA and IMHANS for organizing this webinar, and special thanks to our speakers, Dr. Yuman and Tasneem, for their excellent presentation. As Shaheen mentioned earlier on, that a lot of food for thought, lots of helpful tips, and I'm sure there'll be plenty of questions. And I'll try my best to go through all these questions, and if there are any questions which I can't, I will have to filter, unfortunately. Please don't get offended. And so we talked about mental health. That's the theme, impact of COVID on mental health. So as we know, good mental health is an asset and is linked to positive health. And there is the Royal College of Psychiatrists campaign and slogan as well, no health without mental health. So very important, mental health and well-being. And without taking too much of time, let me go straight to the questions. And in addition to Tasneem and Dr. Yuman, I think if people are okay to ask questions to Shaheen or even Mudasir, they will be more than happy to answer your questions. So the first question, I believe, is from Rupa. And I think this question would be appropriate for Dr. Yuman. How could other states learn from your state's experiences? Dr. Yuman?
Thank you for this question. One thing is that telepsychiatry is a field which needs to be considered during this pandemic, because we catered a lot of patients who could not be seen in person through video consults and through telephonic consultations. Even psychotherapy was being provided by online sessions, and the telepsychiatry guidelines have been already issued in India in May 2020, and following those guidelines. So telepsychiatry is one aspect, one field which we can implement and which we can use during this pandemic. The second thing is that patients who need emergency services, they can go even if the hospital settings permit there in other states, so they can avail those services. But if they have been converted, because most of the hospitals other than the our Institute of Mental Health and Neurosciences got converted into COVID hospitals or COVID designated centers, so telepsychiatry is an option which is available. And the second thing is that the studies done on the copings show that majority of people in our settings use family activities as a method of coping, like involving with children, like involving in family activities, cooking, baking, because a lot of females, while I was interviewing them about their coping skills, they said that they used to watch videos on YouTube about cooking, about baking, and they use those as a method of coping. So our coping varies from the coping seen in other parts of the world. So involving with children, or using your hobbies, which most of us won't get time to invest in. So those can be the things which can help us to go through this pandemic. So that thing can be seen from our studies which have been done in this part of the world.
Thank you, Dr. Yuman. And there are lots of positive feedback and comments about your presentation for both speakers, which is really encouraging and good to see that. Then there is a question from, just give me a minute, I think, Irshad Pare, and his question is, please mention whether counseling reassurance services were provided or being provided to the COVID-19 affected in the care centers, hospitals, or in the community settings anywhere in Kashmir. Again, I think, Yuman, you would be in a better position to answer this question.
Thank you for this question. Regarding the community settings, it's not possible. As we all know that this pandemic is, we have to maintain that social distancing. So it's not possible at this time to go into the community and provide services. But yes, there are helpline numbers which have already been issued through Directorate of Health Services, which have been issued at time to time through IMHANS. There have been online counseling sessions being provided. Counselors are being giving counseling services on a rotational basis every day from 10 to 4 or from fixed times. There are timings also mentioned in those numbers, so people can avail those services. And regarding the patients who are admitted in various hospitals, as I already told about the consultation lies on psychiatry, so we go on seeing patients. Even we consult those doctors which are present in emergency medicines, which are working in ICU. So sometimes we consult them on phone to give services to those patients who are admitted there, or sometimes we go in person wearing PPE, masks, and face shields, and we see those patients which are admitted in the hospitals, be it SMHS hospital, be it Chest Disease Hospital, or other hospitals who are the major COVID-19 catering centers or COVID-19 catering hospitals in Kashmir. So we go there and see patients. So we provide those services to the patients admitted in the hospitals.
Thank you very much for your answer. I'm just looking at the chat box if there are any questions. I can't see any other question at the moment. Shaheen, can you see any other questions?
Not in the chat function. No, there isn't any in the chat function, but I could ask a question to Tasneem, if that's okay, Zulkarnain.
Sure,
Tasneem,
please go ahead.
I just wanted you to give us, give the audience, especially those who have joined us from Kashmir, how do they stick to having a positive attitude, or how do they hang on to hope? How do they hang on to thinking more positively in the midst of, a lot of chronic difficulties, uncertainty, living in a conflict area where things change very rapidly from, day to day, even sometimes, within a day. And to cope, with what you mentioned in your presentation, with isolation, with, even Yuman said loss of employment, no proper structure, being locked up, being in consistent lockdowns. Would there be any specific tips that would actually help them keep that positive attitude or hang on to hope in the midst of all of these uncertainties and difficulties? Thank you.
Thanks for the question, Shaheen. I think you're absolutely right. As much as we make big lists, it's difficult to remind ourselves and hang on to those hopes and positive thinking. And I would say and remind people out there that the biggest thing is, let's not feel hopeless. let's hang on to positives. Let's not, we all know it's uncertain, but they can acknowledge and accept, yes, it is uncertain. It's a difficult situation, it's unknown, but we still have a lot of things to be grateful about. So the gratitude list is very important, to remind ourselves what we have rather than what we don't have, to remind ourselves our strengths rather than focus on what we can't do. So remind ourselves, yes, there is a social isolation, but we can still connect with people remotely. We can pick up the phone and talk to and check in with others. And we can talk about how we feel to those who we actually trust. And that's very, very important. I think isolation is one of the things which has affected a lot of people, our young people, or, our elderly generation. And we still can keep the contact by using the social media and positive thinking, and reminding ourselves not to get too overwhelmed, giving the permission ourselves to have that moment of anxiety, stress, have a cry, give permission. It's okay to cry. It's okay to feel upset, but then also remind ourselves, I don't want to be stuck in that situation, in that black cloud, as I call it, for long, because I can do other things, and be mindful of that, and remind ourselves of the strengths, and reach out to family, reach out to friends, reach out to neighbors, get the help for your physical needs. So don't feel shy to ask, and don't feel shy to say no. So I think these are some of the things which people remind themselves. And as I said, that rule of 5, 3, 4, 2, 1, remind ourselves, can I hear something, to ground ourselves more often would actually help to cope with the stressful situations.
Thank you very much, Tasneem. I think there was a lot again in that answer of yours as to how many different skills, thinking models we could use, even in the midst of very difficult situations that we may find ourselves in. I think there's a question that has come through in the chat box. It's Dr. Yuman, for you. I don't know if Zulkarnain is still with us, but I can read the question. It is from Sarfaraz Shora. And the question for you is that there is an alarming trend of suicides in Kashmir recently. From your experience, is this linked to COVID-19 pandemic, or are there any other possible reasons? It's for you, Dr. Yuman.
Thanks for the question. Definitely the increasing trend in the suicides, one aspect is because of the pandemic. Because of the pandemic, there has been a lot of financial crunch, there has been a lot of unemployment. Before the pandemic started in March 2020, there was lockdown, and there was a curfew and other things present over here because of the scrapping of the article and all that. So 6 months prior to start of the pandemic, we already had a situation like that of the pandemic. So we have been living like in lockdowns from last 2 years. Maybe other parts of the world have been seeing this lockdown from last 1.5 years, but we have been living through these similar conditions from last 2 years. So this financial implications has given rise to increased rates of suicide, because recently there was a boy who committed suicide, and in his suicide note, before the suicide, he had revealed that there was a lot of financial issues in the family because of the impact of this pandemic. So definitely that is one aspect of the pandemic giving rise to increased rates of suicide. But then there are other reasons, like the conflict which has been going on from last, I think, 3-4 decades in Kashmir. So the effect of that pandemic, like we people who have grown through all this conflict, there is a lot of increase in the rates of personality disorders being seen in our place. Like we keep on talking with psychotherapists, with psychologists, and we see a lot increase in the number of borderline personality disorder, antisocial personality disorder, and other personality disorders. So impulsivity, we all know that these personality disorders have one thing, which is impulsivity in them. So impulsively, sometimes they attempt suicide out of an argument, out of a trivial fight, out of a rejection, out of getting less marks in exams, which are quite smaller reasons for committing suicide, but because of their personality issues, because they have grown through this conflict through all these years, and their childhood has been traumatized, so that traumatized childhood giving rise to personality issues, giving rise to personality problems in adulthood. So those suicides are on the rise in Kashmir, because now we see a lot many type of suicide who are more of committed in impulsive way. So they simply have an argument at home, or they simply have suffered a loss, or they simply have got less marks in exams. So that also leads to the increased rates of suicides in Kashmir, which we are witnessing currently.
Thank you very much, Dr. Yuman. So obviously, underlying mental illness is a predisposition just to suicide, and certainly some mental disorders more so than the other, like depression, and you spoke about personality disorders where there's much increased incidence of impulsivity, and self-harming behavior is one of them, which is a known factor. Certainly the situation in Kashmir is different from the rest of the world, because the lockdown is much more prolonged, and it's coming up to 2 years at the end of July, plus the other reasons that you mentioned, the unemployment, really no recreation for the younger people to be able to take these extreme steps. I think the other thing to mention is that there is, we were talking about telemedicine, there's Dial a Doctor that is available 24/7. So if professionals here could, again, as part of increasing awareness and giving people that link so that they seek help, they know there is someone available 24/7 that's there to listen to them. And they have a direct toll-free number, which is 1800-889-2729. I have memorized it, although I'm not living in Kashmir, but I think that's how we need to spread the message, because people can feel very desperate in situations and not really know who to turn to, especially out of hours. I think during hours, you'll have your family around, you can seek medical help more easily, but I think out of hours becomes quite challenging. I'm going to see, is Zulkarnain back with us or not?
Sorry to come in. I think he lost his link. He's trying to get back to us. I just wanted to briefly come in with a comment and a question as such. Thank you very much, Yuman and Tasneem, for the presentations, and Shaheen for excellent sharing. I know there's lots of work going in Kashmir with mental health, and I think what I'm trying to sort of say and discuss is that there is help available everywhere. There are psychiatrists in every district compared to many years ago. And there are, like Dial a Doctor, few other helplines as well, which are in the public domain, which can be just looked up by various charities. And I know psychiatrists from IMHANS and other places, Middle East, and we from England, we do join in with Dial a Doctor and other lines, and usually the help is available between 8 a.m. to 12 p.m. So if somebody wants to call in, they can call in. In fact, we have been getting calls now from outside Kashmir, sometimes from Uttar Pradesh, other districts of India and rest of India. So Yuman, it would be really helpful to sort of, if you can summarize kind of where other places or districts the service. I know most of it, but it's better if it comes from you. I have been away from few years now, so I may miss some of those. That would be helpful for general audience, because we'll be putting this video on in public domain. Thank you.
So we have a psychiatrist almost in every district, like from district Pulwama, we have Dr. Majid, who always keeps on sharing his number on WhatsApp even on Facebook, to the patient so that he is available for the patients. Then we have from district Ganderbal, we have a psychiatrist. From district Kulgam, we have Dr. Tariq. So we have almost all that. From district Anantnag, we have Dr. Mansoor. From district Baramulla, we have Dr. Tajamul. So there are psychiatrists almost in every district who are available for the patient, who keep on sharing their numbers. And recently, Directorate of Health Services also issued numbers of various psychiatrists in different districts, along with the timing of when they will be available for the call, like from 10 a.m. to 4 p.m. or 10 a.m. to 5 p.m. So those numbers have already been circulated to the people, to the public domain, so that they can avail the services. They can call the psychiatrist whenever they feel. Even psychotherapy services are being provided online here. Like psychologists go to the DC office by rotation. They go twice a week. So those services are also like patients who need online counselings, who need online psychotherapy during these pandemic times. So they can call there in the DC office, and we have a psychotherapist available there who attends their calls for the whole day and gives them psychotherapy online in keeping with the guidelines issued by the telepsychiatry. Like the session should be around 30 minutes, 30 to 40 minutes. So keeping in view those guidelines, even psychotherapy sessions are also available online for the patients.
Thank you very much. I think that's helpful to them. The other thing I wanted to say is, obviously, I think we also need to say that there are lots of female psychiatrists available in the Valley now, and many people shy away from at times talking to men. So if anyone is listening, there are lots of, because I get calls sometimes, they want to talk to female psychiatrists, which is helpful. I see Dr. Zulkarnain Ahmed is back chairing this session, so welcome back if you can hear us.
So sorry about this. Just got disconnected and it took me time to log on. Joys of technology, unfortunately. So let's carry the discussion forward. I can't see at the moment chat I can't see the chat box at the moment. Can anyone else?
No, there are no more questions, I believe there.
A question actually for Dr. Yuman, but if there is a drug and alcohol specialist here, I see Dr. Adil is with us. I'm not sure whether, he may be able to type in the chat box. I was quite alarmed to see that the data that was collected by Dr. Yasser Rathir, who is your addiction specialist, in terms of the opiate use. But what was very worrying and alarming to see was the increase in incidence of IV drug abuse in contrast to other means of using it, whether it's what is called chasing or other forms, because obviously the risks, both in terms of the impact on physical health, in the worst case scenario, even cardiac complications, and sadly in some cases can cause death. I was wondering whether there's more qualitative narrative to what has changed, because I would think that getting syringes, needles, and all of that would be more difficult in a lockdown, in contrast to if all the pharmacies and all the drugstores and everything was open, and whether there has been a deeper dive into trying to understand why the trend, especially in teenagers, young adults, and young people in their 20s or late teens, are resorting to this method. Dr. Yuman, thank you.
Thank you. Actually, they are now studying the underlying reasons for this increase in the prevalence of substance abuse, which has recently been shifted to more of IV abuse. We see a lot of patients using IV forms of opioids, most commonly heroin. So again, the conflict has given rise to a lot of personality issues among the teens. So they were the same children who grew out of this conflict. So their childhood was all along these conflict years, and now they are in their teens. They are now in their late 18, 19 or early 20s. So that is one hypothesis which has given rise. The second thing is the increased rates of unemployment being present here. So they are not employed, they are doing nothing, so they want something out of those to get the recreational or just to have enjoyment. So that is another hypothesis. So third is which we all know, that adolescence is the age of risk-taking behavior. So adolescence has an in itself, it is a high-risk age, and we need to cater to this age group. But we are very much worried about the availability of these drugs and the availability of this syringe. Even in the lockdown, there were a lot number of patients, which I also saw sometimes, who started using substances, who started abusing heroin even during the lockdown. They said that they have a history of abusing this from last 6 months, or maybe 6 to 9 months only. They were not using it in the past, and they have now been using it from past 6 to 9 months. So that is more worrying, that they are being able to access these substances, they are being able to get to these substances, syringes and other things. And there are many cases of overdose deaths. There are many cases of hepatitis C. There are many cases of HIV we are seeing because of the increase in the use of IV opioids. So more of this has erupted as an epidemic of opioids in Kashmir at present. We are living in the epidemic of opioids.
That's really very helpful. Thank you, Dr. Yuman. I'm just mindful of the time.
Dr. Adil wants to make a brief comment. Sorry to interrupt. He's with us, and Tasneem has some question, and then we conclude. Thanks, Zulkarnain. Adil, if you want to go ahead, please.
Yeah. Hi. Can you hear me?
Yes.
Yes.
I think wonderful presentations from Dr. Yuman and Tasneem. I just want to comment on this IV drug use. I think it is really concerning. Just because, as Dr. Yuman said, that there is high risk of overdoses and drug-related deaths when it comes to IV drug use. And I know in Kashmir we have very limited facilities around, especially if somebody overdoses, and especially because there isn't enough education and awareness among youth around IV drug using. So I think, if we compare it with the UK, for example, there are lots of facilities in terms of awareness and education available here. And it's not only that. For example, with opioid IV drug use, naloxone, which is an opioid antagonist, which is being used, and we do offer it to every patient who comes to our service with opioid addiction, so that they can keep it with them. We have got injectable naloxone, and we have got a nasal spray as well, which is very helpful in opiate users in terms of preventing drug-related deaths, and it is very, very helpful. And I hope we have got it there, because that is something which we should be giving to most of the people who are using opiates. That is one. Then another issue with IV drug use will be obviously bloodborne viruses, which is risk of HIV, Hep B, Hep C, and I think that's something we need to do a BBV screen every time they present to our services there, and then offer them, if they've got Hep C treatment for that, or offer Hep B vaccination. So I think we are planning to do a webinar on basically looking into how services in UK work and how we can support services back in Kashmir, in terms of whether then we need to share anything from here, the good working, and if we can make changes there in Kashmir as well, in terms of how the services work. So we're hoping to do that webinar sometimes very soon. So hopefully we'll try to explore things in detail at that time, and see how we can link up together. Thank you.
That's really very helpful. Thank you, Adil, for your comments. And yes, substance misuse or addictions webinar is in the pipeline. Watch out for the space for that. Just mindful of the time, just quickly want to mention, we talked about a lot of negative things about impact of pandemic, generally the negative impact. I just wanted to ask the panelists, any positives from this pandemic, either in your personal or professional capacity, you want to comment on?
Yeah, so can I actually was going to make a comment, but I think that's the right thing, right question you ask. I think as much as COVID has been clearly has had a very negative impact, the positives of it has taught us a lot to do remotely, which we weren't able to do before. It has taught us to connect with people remotely, which we weren't able to do as much as before. It has also taught us to provide the psychological support to people. And that's what I was actually going to talk to Dr. Yuman, because she's in Kashmir and I'm in UK, that there are remote help. There is a remote help which people can actually tap in and access. We don't necessarily need to be in one room in one country even to access those those support lines, those helplines. And it will be interesting if you're able to share. I know very well of one charity called Listening Hearts, and they also provide psychological support, and I'm a member of that. So it's something positive which has come out of COVID personally for myself, as well as I think from my professional work.
Thank you very much, Tasneem. Yuman, anything you want to comment on positives?
As is said, that there is always a silver lining behind the cloud. So I think this pandemic has increased like the time spent with your own family, because all the time we were so busy, especially in our profession, with our work, with going to work every day, and then with other things. So we didn't have that much time to spend with our family. So from my experience, that is maybe we got more of family time, spending time with children. We learned to cook some more meals, and we learned to bake, because there were many patients who were using these things now as copings. Whenever I used to ask them what you did during this to cope with the pandemic, so they said that they used these things as a coping.
Thank you very much. That's a really nice way to put it.
Thank you.
Having spending more time with family. Shaheen.
Yeah, I think, pandemic is a challenge, but my experience personally and generally speaking of life is that it is challenges that make you shine. I think if life is, going normally, you don't really necessarily get the opportunities. I mean, people have spoken about connectivity. I mean, we are all from different parts of the world speaking to each other. This didn't happen before COVID. Although the technology was there, it was, we didn't think out of the box. So I think thinking out of the box and making use of technology, not just to connect, but in terms of delivering healthcare. And I think telemedicine is going to be a huge thing in years and decades to come. I think the other thing which I want people to, understand is that difficulties also create opportunities. So for me personally, last year when, Kashmir was hit with COVID-19 pandemic, we've got a group of British Kashmiris here that run a social enterprise called Atwas. So we did a lot of charitable work to help our people back home. And it was amazing to see, the generosity of the people. And donors weren't Kashmiris. They were, they were British. They were from different regions of the world, from UAE to America, to Saudi Arabia, to Australia. And it was amazing. I mean, we raised over £30,000 for a place called Kashmir, to help people in need, to help those distressed. So I think that would be my experience, but I'll now stop.
Thank you very much, Shaheen, for sharing that. I'm just mindful of the time. I think we're already 5 minutes over the scheduled time. I think we should draw it to the end, and I will hand over back to Shaheen for closing remarks. Shaheen.
I thought we wanted to give Mudasir a chance as well to see how COVID has impacted or any.
Oh, sorry, Mudasir, I forgot about you. I was just mindful of the time, so that's the reason why.
So I personally just want to thank everyone who, Shaheen, Yuman, Tasneem, and I also want to thank people who attended. I know busy time, and I can see Professor Margoob in the audience, and some of my other friends are there, which is nice they're there, and hopefully next time we'll have a discussion with them as well about other issues of mental health and collaborate further. Thank you.
Great.
So it's back to me. I think it's been a very informative webinar. We have heard of some very enriching experiences from Kashmir. Tasneem gave us some very good tips in terms of coping. And we are grateful to both of you, Dr. Yuman Kawoosa and Tasneem Shikoh, for your time and for giving us such an enriching session for the webinar today. There's a few thank yous. I would obviously like to thank the British Kashmiri Medical Association and colleagues in Kashmir who are from the International Mental Health Association of Neurosciences. Is that how we spell the IMHANS? Is that the
Institute of Mental Health?
Institute of, I beg your pardon, I thought there was something wrong. So it's Institute of Mental Health and Allied Neurosciences in Kashmir. So all the colleagues that are part of it, I want to thank them. I've already made you international, so here we go. There are people that are in the backstage, but always very, very helpful. And without them, we wouldn't have been able to, have this webinar, but also have it live on Facebook. And my particular thanks to Zarka Batul and Amina Bacha, who are the core members of the British Kashmiri Medical Association, our interim president, Dr. Farooq Wandru. And as we said, we've had some esteemed participants. I want to say thank you to everyone who logged in and stayed on, and some esteemed colleagues in the audience, as Mudasir said, Professor Margoob, and I have Dr. Sadakat Drabu as well. She sent me a message. So I think it's 20 years probably. Over 20 years ago, she was my teacher. So I think she's here in the audience. She sent me a message, so it's really a pleasure to have her here as well. And I would like to finish on what Dr. Yuman said in her presentation, that the greatest glory is not in falling, but it's getting up after you fall. And I think that's what we should think about this COVID-19 pandemic as well, that, yes, it's tested our resilience, it tested our strength, it's tested us on every level, but that's life. So, I hope that we will all come out more resilient. And one of the ways of coming and becoming more resilient or coming out more resilient is by helping one another. That's the best way of being resilient. So thank you very much, everyone. And I would like to thank my colleagues, Dr. Mudasir Firdosi and Dr. Zulkarnain Ahmed, who were the co-panelists with me today. And thank you once again, Dr. Yuman Kawoosa and Tasneem. And thank you, everyone, for attending. Okay, assalamu alaikum. Stay safe and be happy, and try to look after your mental and physical well-being.
Thank you.
Thank you.
Thank you.